Hi, I'm Arvind Kanche. I am the social media task force member for the International Society of Nephrology, and with me is Professor Vivek Jha. Uh, Prof. Jha is was the head of Department of Nephrology and Professor of Nephrology at the PGI Chandigarh. He is now based with the George Institute in New Delhi doing cutting edge kidney research. Dr. Jha, I'd just like to ask you, you have been to the Indian Society of Nephrology conference. Today is the last day. How do you find it? There is a lot of research going on. The numbers seem pretty small in pockets of areas. Do you think we need a clinical coordinator or a trial coordinator to ramp up the numbers? What is happening? What do you think we should do about this?
Thanks, Arvind. So, as you said, we are on the last day of this 4-day long meeting of the Indian Society of Nephrology. By the way, we also had a South Asia regional workshop of the International Society of Nephrology here because we had the president-elect, Dr. David Harris, and we had colleagues from neighboring countries, Bangladesh, Sri Lanka, Nepal coming in. So it was an opportune time to have this regional workshop, which was very successful. So coming back to the question you asked, that's a very important question because in the International Society of Nephrology is also thinking on the same lines about how can we rev up research activity in underdeveloped regions. South Asian region has one big country, which is India, and a number of other relatively smaller countries compared to India. So India has to be perhaps the leader in this area to support increasing research activity in the entire South Asian region. And for that, you are absolutely right in saying that we will need at least a few groups or a few organizations which could include academic institutions in India with nephrology training centers, or for example the George Institute, which does a lot of clinical research, and bring out a few people who could be, as you say, coordinators or consolidators of research activity and support individual researchers in different organizations to do research which is relevant to the needs of the healthcare community and kidney patient care community in the entire South Asian region. And this will then serve to sort of knit into a global community, which is one of the missions of the International Society of Nephrology by the formation of its committee on clinical trials called ISN Act.
Excellent. You are also going to be involved with the WCN, or the World Congress of Nephrology in Mexico. You are speaking on a topic there. What do you think is going to happen at the WCN? Give me some details on what you're going to speak about.
So the WCN is going to be in Mexico City, which is a country with very high rates of obesity, diabetes, and kidney disease related to these two rapidly emerging conditions, very relevant to the entire developing world. South America is also a continent which has been known for having pockets of patients with chronic kidney disease of uncertain etiology. So these are the two themes which will be very much in the front line during the World Congress of Nephrology at Mexico City. Number of sessions have been organized around these topics to discuss the burden of developing kidney disease due to these conditions, and what can we do in a cooperative way to develop strategies to reduce the burden of the diseases that will eventually lead to chronic kidney disease, but also to reduce the rate of progression of chronic kidney disease in these regions. These topics are, as we know, Arvind, important also for South Asia and for other emerging countries around the world. And another important feature of the Mexico City World Congress will be organization of a policy forum in which policymakers, nephrologists, members from multilateral organizations like the World Health Organization, the United Nations, the PAHO in South America will get together for a day to discuss how to develop a policy to increase the ability of the global community to tackle the rising burden of kidney disease.
Prof. Vivek Jha. Thank you very much.
Thanks, Arvind.